Dr. Cidambi, an addiction expert and medical director of the Center for Network Therapy, joins us now to discuss. Welcome, Dr. Cidambi. Thanks so much for being with us. We recall bath salts being in the news in 2012 with a similar horrific incident. Is Flakka related to bath salts?
Yes, it is. Flakka is a designer drug, and it has alpha PVP, which is a cousin of cathinone. That is the chemical, synthetic chemical that's present in bath salts. So the similar kind of similar effect is what you're seeing with
And you said earlier that bath salts is a sort of a synthetic form of marijuana, and Flakka is like a synthetic form of cocaine? Is that?
Flakka is a synthetic form of cocaine, and
Right.
K2 is a synthetic form of marijuana.
So then does Flakka react on the brain like cocaine, just times what?
10 times more powerful.
Oh my
The
goodness.
same way that cocaine acts. It's a stimulant.
It's a stimulant. And so the description of somebody growling or seeming to have, thinking they have superhuman strength, does that sound like the kind of side effects that Flakka creates?
Yeah, if you have to look at Flakka acts on two different neurotransmitters. One is the dopamine, which is the pleasure kind of reaction, so you get euphoria, and the second one is a norepinephrine, which is adrenaline rush, layman's voice. So when they get that rush, you become very powerful and like so much of strength in them. The temperature goes high, so they rip off the clothes and run naked. That's what you see.
And do they start
violence.
hallucinating as well?
Yes, they hallucinate, and that's what you saw that with animal sounds and stuff like that. And they become self-injurious, and they can become extremely violent. That's called excitement delirium.
And where is Flakka coming from? And are you seeing it here on the East Coast as well?
Typically, it's been on the internet. You can buy it online. It's been manufactured and sent from China.
Oh my goodness.
So recently, I've had exposure to Flakka website through one of my patients, and I got that education, and I was speechless when I first found out what it was.
And it's very inexpensive, correct?
It is $5 per hit.
$5 a hit.
Right.
So is this a growing epidemic? Are you seeing more of it?
It's more of it right now because, it's so easy. Mm-hmm. It's being cheap, $5 a hit, and they can buy it in a bulk. So it's easy to buy and easy to use. So, that's what people are running after.
This is really terrifying. So tell us, is there any counter medication for Flakka?
Unfortunately, we don't have any detox medication as the same kind. Like, if somebody uses cocaine, we don't have any medication to treat them.
Right.
For detox. The same thing with the stimulant here. We don't have any medication, but we can do all kind of cognitive behavioral therapy and those things. But the distractibility is very high. They can only pay attention for 20 minutes. So it has to be a lot more work with these patients.
And so if you suspect a loved one may have been taking Flakka or is developing an addiction, you say it is a very addictive drug, correct?
It is very addictive because it creates a lot of cravings and urges in them, and they keep using it. And they also crash when they don't, they come off of Flakka. It's a crash. They get depressed, they're anxious, they're tremulous, and then they're not sleeping well. So it makes them also psychotic at that point in time. So they want to get better, and they keep
taking
using it.
So what can we do for loved ones who we suspect may be having this problem?
Get them for treatment. It is a therapy, which is that's most important. And also really watch out for warning symptoms.
Right. What are the warning symptoms? Just this behavior you're discussing.
Absolutely.
Dr. Cidambi, thank you so much for that.
More lethal drug overdose death is more than the car accident deaths. In 2014, if you look at the deaths from overdose, has been 47,500, out of which 29,500 has been just due to overdose from pain medication and from heroin use. And it's 33,000 for car accident. This shift has occurred because there has been overprescribing of pain pills. In 2013, there has been a huge increase in the scripts for opioid medication. That has been increased to 200 million from 79 million script from 1992. This has really led to people dying from opioid overdose. And we have to look at 10 million Americans today are taking one form of pain medication to address their pain, chronic pain. And saying that nearly over 7 million people are either addicted or dependent, in a colloquial ways, hooked on to pain medication. What is surprising to us is that these scripts are not written by the specialist. 20% of these scripts are written by primary care physician and the internist. So it's important for doctors to pay attention to what we are writing and how we can curtail these addiction epidemic right now from preventing patients from abusing it and overdose and deaths. It's striking, it's more surprising to see fentanyl, which is a synthetic opiate medication, has been overriding the overdose and death, even when you compare it with heroin overdose and death in most of these cities in the United States. In the year of 2015 in New Hampshire, there were deaths from heroin, 32 people died from that. Compared to fentanyl overdose and death, 158 people have died by using fentanyl. Fentanyl is a synthetic opiate, as I had mentioned earlier. This has been sold in the market as a finger. One finger is equal to 10 grams of fentanyl. And the striking thing is that when somebody uses fentanyl, it's a fast-acting opiate. We have had this naloxone revival program, which is quite successful to revive people from getting overdose and death. But that doesn't work very good with fentanyl. The reason being that, as I said, it's a fast-acting opiate, and people don't even have time to pull their needle out by the time they're overdose and dead. So it's these are the statistics that one has to keep in mind before we write those prescriptions as physicians.
Dr. Indra Cidambi runs Network Therapy in Middlesex, New Jersey. The ambulatory outpatient detox not only helps addicts wean off the drugs, but it also offers them counseling and therapy, two services that Dr. Cidambi believes will be kicked to the curb when patients no longer have to regularly see their doctor.
Our American culture has become like, I want quick fix, I want a pill, happy pill, sad pill, I want it all. Medication should fix me. We need to stop and think. Medication is not an answer.
There are no beds here, just chairs. This is the first outpatient rehab center licensed in the state.
I can go back home, I can go to work, I can go to the gym or whatever, and then I come here and do my therapy and my treatment.
A typical day patient would come in at 9 o'clock in the morning and stay here until 7 p.m. They get their last dose of medication and we sign them out to the family members, and they go home to the safe environment with the family support.
Supporting the family, 24-hour on-call nursing staff. The center's treated patients for alcohol, opioids, and benzodiazepines over the last 3 years. The Center for Network Therapy boasts a 60% success rate, that is 90 days sober, among its 600 patients over the past 3 years.
The person sitting here today was not the person who walked in here over a year ago.
Brandy Bamber owns one of those success stories.
I was very sad. I was a shell of a person. I wasn't a mother. I didn't care. I didn't care about myself. I didn't care about you. I only cared about what I could get from you and just one more. I would leave my kids home alone for an hour or two to go cop, and I wouldn't be able to deal with my life if I wasn't high. My life centered around getting, using, and nothing else mattered.
She says her downfall was a prescription for Percocet to treat a hernia. She got hooked.
Pills were just too expensive. I just knew that. So I just went to the source that was cheaper for me. So when I'm 30 years old, I'm sniffing heroin. By 31, I'm shooting heroin. And by 32, I wanted to die.
Bamber completed 5 weeks of outpatient treatment at the end of 2014, a last resort after a few weeks in jail and 2 stints in inpatient rehab.
You don't have to worry about anything but getting clean. But when you come home, you're faced with the pressures of schoolwork, the chaos of kids fighting, cleaning the house. It gets to be very overwhelming.
Not everyone meets the criteria for treatment. You can have no active psychiatric illnesses or medical complications like seizure or stroke. Dr. Cidambi said most patients come in after they're rejected from inpatient detox.
The Center for Network Therapy says that insurance covers most of their patients at 100%. The out-of-pocket cost without insurance is around $400 a day, but the team here says that's only about a third of the cost of a traditional inpatient facility.
Bamber's treatment was covered. She told me she wanted to do this interview to give back and to move forward.
I'm proud to be who I am. I'm proud to have gone through what I've gone through. I'm proud to be the mother I am today. And my struggles have taught my kids what not to do. I have a 15-year-old son that I'm very proud of. I mean, he's not that 15-year-old kid that's in high school smoking weed, and he's not. I have beautiful daughters that are growing up to be amazing women. And that's only because of what I've gone through and what I can teach them today. So as long as I keep growing, I can continue to teach them things.
Teaching not just from the past, but on tackling the future. In Middlesex, I'm Erin Delmore, NJTV News.
An autopsy results revealing that the official cause of death for music icon Prince is a drug overdose, but the investigation far from over. Here's what we know. Prince died of an overdose of fentanyl, powerful opiate that is up to 50 times more potent than morphine. Questions that remain, though, did Prince have a prescription for that drug, or was it supplied illegally, possibly? And if it was illegal, who provided it? That person could face criminal charges and the possibility of prison time. Joining me now is Dr. Indra Cidambi, Medical Director at the Center for Network Therapy. You deal in this kind of thing on a daily basis.
Yes, I do.
And fentanyl, I mean, the strongest of the strongest, right?
Yes, it has a very high potency among all the rest of the opiates.
So could he have gotten this drug legally?
It could be. You can get it both legally and illegally.
And so it comes, you're describing to me that it comes in a patch.
Yes, you have fentanyl patches, fentanyl lozenges, fentanyl lollipops, and it comes as a powder that they lace with heroin on the street now.
Okay, so people hear fentanyl lollipops. I mean, that makes it sound like it's just fun and games to be able to suck on a lollipop that is so incredibly powerful. Correct. Is that the right form, or is this specifically for people that are just incredibly in pain? Obviously not for addicts.
It is mostly, fentanyl is mostly used for post-surgical pain, acute pain. Once you have a chronic pain, one has to take a regular opiate. And then for the breakthrough pain, we give fentanyl.
Okay, I want to look at this chart from strongest to weakest, keeping in mind that Prince died of the strongest, fentanyl at the top there, 50 to 100 times stronger than morphine. I mean, you think about morphine, most people don't make any sense when they're on morphine, and the list goes down there. Heroin, oxycodone, other ones I've not heard of, morphine, and then, of course, codeine, which would be one of the weaker ones.
Right.
So if somebody had a drug addiction for a long period of time, is that how they work their way up, obviously, to the strongest drug?
You know, the way to understand this, the higher the potency, like fentanyl, the stronger the addiction. What happens is if you start off with a opiate, like say Percocets, that's what you commonly get prescribed. You get tolerance developed for that drug, and you want more and more, and you keep increasing the dose. At the end of it, you want to get something quick in and quick out. That is what fentanyl does.
But we have a huge crisis in this country. Prince aside, he unfortunately died from it, but tons of regular folks are dying from this every day, and it's on the increase.
Correct.
Why, and what are we going to do about it?
Why do we have this kind of a raise? Is because the culture. We want quick fix. We want pill for everything, a happy pill, so we want to numb ourselves. That is the society that we need to change. That means you cannot address this kind of addiction by giving more and more pills. You need to really address this by giving therapy. That's something we are not really subjecting our population to,
Wow. It's a fascinating discussion, and one that's very tragic for so many families going through this right now. Doctor, thank you so much.
You're welcome. Gary, I'm a medical doctor. I have an MD degree. I came into this country and I got trained in psychiatry. And then I did my residency from Maimonides Medical Center and then went into NYU in the city to do my fellowship in addiction. I did 2 years of fellowship in addiction and then started my journey in New Jersey. So here I have my ASAM. Now they call it as an American Board of Addiction Medicine. So I have a double board. So with our model, the minute they call, there is no waiting period. They could drive, come right in. We are open from 9 a.m. to 7 p.m. So they can make a phone call as late as 3, 4, and we call them, come right in. Right. So they get to see.
So you realize that you can't lose that window of opportunity.
No, because
your only window.
That's the only window. And that window, when they come in, they see it's not non-threatening environment because you are not held against your wishes. You can walk out as and when you want, but I tell you what, it's very hard. We face a different problem in our facility. The patients don't want to leave. They love it there.
Right.
They love it there, and they say.
You said something to me before that I found unbelievable, quite frankly. You've been open for 2 years, and you haven't lost
not a single patient. Wow. There is not a single patient who ended up like.
Wow.
So somebody comes in, just take us through what happens. Somebody calls you up. They say, my son, my daughter, I just opened up their bag and I found heroin, and I had a conversation, and they said, yes, I'm doing heroin, Mom and
Gary,
Dad.
in order to answer to this question, you should also understand it's not just the pills, opiates. I also detox patients from alcohol and also benzodiazepine. When you say benzodiazepine, like Xanax, Klonopin, Valium,
Very
popular ones. Like, because you might see always it's a polysubstance use. A person might say, my drug of choice is heroin, but I also do Xanax because I'm anxious. That's been prescribed by a physician.
And when they can't get the heroin, they do the benzos.
Yeah, but that combination is deadly. Somebody might be doing 5 bags of heroin, just a milligram of Xanax. But that Xanax can really shut down on your respiratory center. And that's what you see most times. The parent walks into the room, the child is unarousable, and they're gone. And the combination of benzodiazepine with opiate is not a good thing.
Deadly combination.
It's a deadly combination, and I'm telling you, having been practiced for so many years now, I really see how easy we have this combination that goes on. Not only that, even the psychotropic medication. People just put people on Seroquel to go to sleep. You need to understand it's an antipsychotic medication. It has got endocrinal problems. One starts having excessive weight gain, and the lipid profile goes up, and eventually end up as a diabetic. So you need to be thoughtful about it.